Hi, everyone. As a doctor with more than 15 years of experience in integrative medicine, my name is Leila, and I have personally witnessed how something as basic as our daily dental hygiene practice can have a significant impact on our general health. You see, your mouth serves as the entrance to your complete body, not simply your grin. Not only are symptoms like chronic bad breath, swollen gums, or dental sensitivity annoying, but they can also be signs of more serious issues that impact your self esteem, digestion, and even the health of your heart. I want to reveal a game changer today, the best natural mouthwashes that can actually bring your oral ecosystem back into equilibrium. This discussion is for you if you've ever been frustrated trying to find quick cures with those gaudy store bought items only to wind up worse than before. You will have useful, scientifically supported tools to restore a healthy, fresh mouth that feels as wonderful as it looks if you stick with me through to the finish. I'll begin by sharing a story from my clinic. Sarah, a patient, arrived just last week frustrated. She has been dealing with persistent bad breath for years, and she is a busy mother in her 40s who is constantly on the go. She had sampled every vibrant mouthwash available, including some that advertised 24-hour protection or Arctic blast freshness. However, the issue would often resurface after a few weeks, making her uncomfortable at meetings and even at family dinners. Does that sound familiar? You're not by yourself. Millions of people suffer from dentin hypersensitivity, gingivitis, or halitosis, and they frequently spend money on treatments that make their conditions worse. In actuality, a lot of commercial mouthwashes are like applying a band-aid to a broken bone. They cover up symptoms without treating the underlying reason, and occasionally they even induce new issues. Consider those vivid green or blue rinses that are advertised with performers grinning flawlessly after a 30-second swish. Don't they feel energizing? Clean screams from that burning feeling. The alcohol in them is a double-edged sword, though, which is insider information that the industry doesn't promote. It turns your mouth into a parched wasteland by evaporating its moisture. Why is that important? Your mouth's natural defense is saliva, which neutralizes acids, removes food particles, and controls dangerous bacteria. Bad bacteria flourish unchecked when your mouth dries out, which increases plaque, cavities, and that dreaded morning breath. Daily alcohol-based rinses have exacerbated xerostomia, or dry mouth, in patients I've treated in my practice, leading to a host of problems like fungal overgrowth and even an elevated risk of oral infections. However, things worsen. Although these powerful antiseptics claim to kill 99.9% of germs, they are not selective. They also destroy the good bacteria that help with early food digestion, keep your mouth's pH balanced, and stop yeast from taking over. When you bomb a garden to eradicate weeds, you also harm the flowers. Rebound effects, such as stronger smells, increased inflammation, and transient freshness, are caused by this imbalance over time. I've also seen it in studies. A study published in the Journal of Clinical Periodontology revealed that using chlorhexidine-based rinses for an extended period of time, which are found in many products, might disturb the oral microbiota and create resistant bacteria. Patients tell me that they get caught in a cycle of reliance as their feeling of freshness fades. It's devastating because harmony, not sterilization, is what your mouth is begging for. The good news? Nature provides kinder, more efficient substitutes that respect the fragile ecosystem of your mouth. These are tried-and-true methods supported by contemporary science, and they are frequently far less expensive than bottled alternatives. They promote long-term health without the negative side effects by addressing issues at their root. I've suggested these to hundreds of patients over the course of my career, ranging from elderly people with dry mouth to athletes with gum disease, and the results are astounding. Let's begin our exploration of 7 potent natural rinses, beginning with one that is most likely now in your kitchen cupboard. To help you put this into practice, I'll go over how each functions, how to utilize them properly, and provide real-world examples. Let's start with sodium bicarbonate, sometimes known as baking soda. The battleground can be shifted in your favor with the help of this inconspicuous white powder. Acidic environments are ideal for harmful bacteria, which cause gum disease, cavities, and bad breath. Your mouth's pH decreases after eating, particularly after consuming something sugary or caffeinated like your morning latte, which makes it a haven for these microorganisms. They proliferate, create plaque, and emit toxins that damage gums and enamel. Baking soda changes the balance by immediately alkalizing your mouth and increasing the pH to a point where beneficial bacteria thrive and harmful bacteria find it difficult to live. For patients with acid reflux, which frequently manifests as oral acidity, this is, in my experience, a lifesaver. Mike, a truck driver, was one man who suffered from persistent heartburn and enamel erosion as a result. Within a month of using baking soda rinses, his sensitivity significantly reduced. However, power necessitates prudence because baking soda can be harsh if used improperly. Since a paste, it should never be applied directly to teeth, since this might gradually erode enamel. Instead, use a glass of warm water to dissolve half a teaspoon. After 30 seconds of swishing, spit. To allow your saliva to repair defenses overnight, do this once a day, preferably at night. If you do it too often, you risk upsetting your normal pH fluctuations. This is supported by research from the American Dental Association, which shows that moderate use can reduce caries risk by up to 20% by neutralizing acids without causing harm. If the pH is restored by baking soda, our next rinse uses oil pulling, an age-old technique that is becoming more popular in contemporary dentistry to further cleanse. This practice, which has over 3,000 years of roots in Ayurvedic medicine, entails swishing oil, ideally coconut, to extract impurities. Since lauric acid makes up almost half of its composition, coconut oil excels in this area. With its strong antibacterial qualities, this fatty acid targets bad guys like Candida albicans, which causes thrush, and Streptococcus mutans, which causes cavities. The logic behind this is that because bacterial cell walls are made of lipids, they emulsify or attach to the oil. Water-based rinses cannot penetrate the absorption of fat-soluble toxins. The oil draws dirt from the gums, in between teeth, and even places connected to the sinuses as you swish. Elena, a patient of mine who was a yoga instructor, had frequent sinus infections caused by oral bacteria. Her breath significantly improved and her congestion subsided after 2 weeks of daily oil drawing. This is supported by research published in the International Journal of Health Sciences, which demonstrates that regular use lowers plaque and gingivitis scores. Technique is important. Take 1 spoonful of virgin coconut oil. If it's solid, it melts in your tongue. For 15 to 20 minutes, swish lightly but not aggressively. It may seem lengthy, but include it into your daily showering regimen. The oil's transformation from clear to milky white, including imprisoned germs, is evidence of its effectiveness. Rinse with warm salt water, brush, and spit into the trash, not the sink, to prevent clogs. Since nocturnal bacterial growth is at its maximum, the morning is the best time. Do it every day for quick effects and 3 to 4 times a week for maintenance. Additionally, it is adaptable. For greater benefits, combine it with various rinses. Use mint or spearmint for immediate freshness that addresses the root causes of smells. The menthol in these plants fools the cold receptors in your mouth into thinking you're feeling refreshed without actually cooling you down. The true power of menthol, however, lies in its ability to selectively combat anaerobic bacteria, which are oxygen-hating microorganisms that hide in gum pockets and tongue cracks. These generate volatile sulfur molecules, which are the root cause of persistent halitosis. In contrast to gum, which merely adds a minty fragrance, menthol chemically breaks down these substances. I've given advice to patients in the clinic, such as Raj, a teacher who avoided intimate talks because of post-lunch breath. That was changed with a daily mint rinse. Prepare. For 5 minutes, cover and steep 10 to 15 fresh leaves, or 2 teaspoons of dried leaves, in water at 80 degrees Celsius. Do not boil, as this preserves the oils. For improved absorption and an anti-inflammatory boost, strain, cool to lukewarm, and then add a pinch of sea salt. Swish 30 seconds after consuming foods high in garlic or other foods that cause odors. It maintains healthy bacteria and is mild, pH neutral, and safe for everyday use. According to a study published in Phytotherapy Research, menthol can effectively reduce oral malodor by 50% in clinical trials. Clove acts as nature's analgesic when pain occurs, such as throbbing gums or toothaches that make eating excruciating. Up to 85% of its oil contains eugenol, its main ingredient, which inhibits calcium channels to block nerve signals and stop the transmission of pain. Additionally, it reduces inflammation by reducing prostaglandins, which cause swelling. For more than a century, dentists have applied temporary fillings using pastes based on eugenol. It is essential for those with periodontitis because it neutralizes the toxins produced by the gum-destroying bacterium Porphyromonas gingivalis. Gloria, a retired nursing patient, saw a reduction in inflammation and a halving of her bleeding gums within a week after utilizing clove rinses as she awaited her specialist consultation. To create, 5 to 6 whole cloves should be lightly crushed before being steeped for 15 minutes in hot, not boiling water. The beer gets golden and smells pungent. Swish for 1 minute for general use and hold for 2 minutes for localized pain. It's common for it to become momentarily numb. Don't do more than twice a day. It could aggravate you. Eugenology also reduces bleeding gums by strengthening capillaries. According to the Journal of Dentistry, eugenol is just as effective as synthetic analgesics. Here's a powerful yet challenging rinse. Apple cider vinegar, ACV. By rupturing chemical bonds, its acetic acid dissolves tartar, those tenacious calcium bacteria deposits. Streptococcus mutans and Candida are killed by it, and it thrives in its low pH, around 3. But watch out, your enamel, which is also made of calcium, is not immune to this acid. Too much use causes teeth to erode, become sensitive, or become translucent. I've warned patients like Tom, a coffee addict, whose severe staining only got better with ACV after I emphasized dilution. First rule, never be pure. In a full glass of water, pH tilde 4.5, mix 1 teaspoon. Swish for little more than 30 seconds, then rinse well with water and wait 30 minutes before brushing. Acid temporarily softens enamel. Use no more than twice a week. Allow time for remineralization. Avoid eating acidic meals right before bed. Overuse symptoms? Heightened sensitivity, take a 2-week break. ACV has antibacterial properties, according to a Cochrane review, but it also highlights the risk of tooth erosion and stresses the need for moderation for eventually cleaner, smoother teeth. Thyme is your herbal hero for focused plaque management. By penetrating bacterial membranes, its thymol disrupts Streptococcus mutans and stops the production of biofilms, which are sticky colonies that eat away at enamel. It is a precision hit as opposed to broad-spectrum modifications. In my holistic clinic, I've recommended thyme as a preventative measure for teenagers who are at risk of plaque from braces. After using it, Liam, a young patient, experienced fewer cavities. Brew. Simmer 3 fresh or 1 tablespoon of dried sprigs in boiling water for 10 minutes while covered. Thymol evaporates easily. Don't rinse after brushing at night. Instead, let it sit for a minute. Use 3 to 4 times a week. Results accrue. How does the morning after feel? Less sticky film and freshness that comes naturally? Thymol has been shown in trials to reduce plaque by 70%, matching commercial antiseptics without developing resistance, according to the European Journal of Dentistry. Lastly, cinnamon bark for a tasty rinse that increases saliva. By obstructing the sulfur enzyme pathways of odor-producing bacteria, cinnamon aldehyde, 80% in Ceylon cinnamon, destroys them and encourages salivary glands for natural cleansing. For people with dry mouth caused by medications or aging, saliva's enzymes are essential because they fight bacteria, restore enamel, and balance pH. Maria, a diabetic patient, saw 2 benefits: improved breath and subtly supporting blood sugar through mucosal absorption. Instead of using powder, which irritates, use bark sticks. For a golden tone, crush a 5-centimeter piece and soak it in water at 90 degrees Celsius for 12 minutes. Store in the refrigerator for up to 3 days. Swish every night. To create harmony, add mint. Per the Mycoses Journal, antifungal as well, outperforming some medications against Candida. Gentle on tissues, suitable for daily use. These 7 provide you with a toolkit: baking soda for pH balancing, oil pulling for deep detox, mint for fresh breath, clove for pain relief, ACV for tartar busting, thyme for plaque attack, and cinnamon for saliva flow. However, personalization is the key to success. Let's use my patient's triumphs to create routines based on frequent problems. Use baking soda every night to balance out the acids in your mouth if you have persistent foul breath. To remove overnight accumulation, use morning mint. For enduring freshness, sprinkle with cinnamon 3 times a week after supper. In just 2 weeks, one patient's halitosis was cut in half. Morning oil pulling is used to remove bacteria from swollen gums and periodontitis. Use clove, Tuesday, Thursday, Saturday, for calming and ACV, Monday, Wednesday, Friday, for deposits. Take Sunday off. After a month, a construction worker experienced less edema. Thyme MWF nights for anti-plaque maintenance. T/TH baking soda for balance. Weekend cinnamon. To avoid adaptation, rotate. Maintaining consistency is essential. Observe changes in 2 weeks, strong outcomes in a month, and a complete shift in 3. Pay attention to your body and adjust if it is agitated. These should not be used in place of brushing, flossing, and dental appointments. Holistic care is what your mouth needs to thrive. I'll sum up by saying that, in my experience as Dr. Leila, these natural rinses change people's lives and demonstrate that you don't need harsh chemicals to maintain good oral health. Simple, age-old knowledge combined with science yields tangible outcomes. Give them a try and then we can discuss your progress. Remain well.